It is definitely a hot one today. Talk about liposuction. So what is liposuction? Pretty straightforward. It is a relatively painless, on the grand scheme of things, procedure that can be done either under local anesthesia in the office or under general anesthesia at the hospital. And it involves making tiny little incisions wherever we need to get access and slipping a little cannula underneath the skin to suck out pockets of fat. Small tiny little incision here. We're going to insert the cannula through the skin, and the cannula at the end is going to start sucking out some of that fat and basically turning your fat into Swiss cheese, making all these little tunnels and holes in there. And we use different types of liposuction cannulas, the different types of tips. They have little cutting edges on them, and that allows the fat to be cut and pulled into the cannula and then sucked out of your body. So what if you don't want liposuction? Well, liposuction does have a little more downtime. It is a surgical procedure. So for patients looking for something that's a little bit less invasive, a great alternative is something like CoolSculpting, or something I prefer, which is Kybella. Kybella is essentially it's an injection like Botox that you can get in the office. It's almost painless. There's a little discomfort right during the injection, and afterwards just a minimal soreness, a little bit of swelling, but it can be done as an outpatient. It's very simple, straightforward, and it's kind of a little secret in plastic surgery world. It's FDA approved to use to treat the double chin area, but actually we can use it all over the body. Anywhere you got stubborn fat, it works really great for those areas, especially small little pockets of fat. So where can we use Kybella? Where can we use liposuction? Any of these procedures we can do pretty much anywhere you can think of. Now, some pretty common areas that a lot of people like to treat: jawline, so get a better jaw definition, get rid of that double chin. This area here, I'm going to show you in a little bit, that pre-axillary bra roll area is a real stubborn area in women to get down, and that responds really well to either Kybella or liposuction. That belly pooch area, and another little place that a lot of people don't think about is the knees. A lot of people have a little bit of extra fat right around the knees, and that's a tough place to liposuction, and oftentimes is a great place to try some Kybella. And switching over on the back side, we've got the bra roll area. Again, responds well to liposuction. Smaller amounts will work really well with Kybella. Flank area, not going to be so great for Kybella because that's a really big fat pocket area in most people. It's going to require a lot of product. A great area though is this little banana roll, which we're going to talk about in a minute. So one area that's a hot topic recently is what everybody's calling the thigh gap. So that's just basically the inner thigh area, and there's a couple components that contribute to that. One is bony structure, but the other is just having some extra fat in the inner thigh area, and treating that area can give some separation to the thighs and give that desired look. So here's a couple examples. Excuse the glare, but here you can really see here, no separation, and now look at how much thinner the thighs are, and we got that nice separation there extending all the way down to another example here, a little bit more dramatic. And again, another case here, a little bit less dramatic, but very realistic, achievable results. So what about the banana roll? Banana roll is a really interesting area. It's a tough area to treat with liposuction, but can respond really well to Kybella. So it's something that we can treat during both a Brazilian butt lift and during a non-surgical butt lift with something like Sculptra. So again, here you can see an example. Hopefully you can see pretty good without the glare. You can really see here kind of that lower banana roll area that's hanging right underneath the crease of the buttocks. And here in the after, you can see pretty much gone. Nice tight crease. Patient here, it's kind of interesting. This patient really just had an asymmetric banana roll, just kind of on the right side, her right side. Left side was okay. And again, here after some treatment with some Kybella, really helped to tighten that up and get rid of that extra roll. And what about those stubborn knees? Another area that we can treat. This is really great for Kybella because it's a small amount, it's easy to do in the office. And here you can see a great example. We're not crazy dramatic, but you can see the bulging going on here in the knees and how much better that is in the after picture. Before and after. Awesome. And what about that stubborn pre-axillary area we talk about, right up in here, right between the shoulder and the breast? It's a hard area to treat. When I do breast reductions and breast lifts, can make the breast looking perfect, perky, nice and round, but that stubborn little bra roll right there often just takes away from the overall aesthetic result. So it's a great area to treat with either Kybella or with liposuction. And here you can see a little bit of a minor case. It's a little bit of glare, but you can see with the Kybella, again here, you got that stubborn armpit pooch or whatever you want to call it, and the after here, a lot better. Another patient here, this patient's treated with liposuction. See those big, almost looks like an extra breast up in that area. And after breast reduction and liposuction of that area, fabulous. Little side view again, it's like a little extra friend hanging out there, and now it's gone. There it is, and it's gone. And one more view. There, and gone. And last but not least, the dreaded double chin, the selfie chin. Everybody hates it, everybody sees it more and more now that we're all doing this sort of stuff, taking selfies with our phones. So this is something a lot of people come in for. A lot of people don't want to undergo surgery and get put to sleep and have all the swelling. So that's why Kybella, that's what it's FDA approved for, is to treat that double chin area. It usually takes 2, maybe 3 treatments, but you avoid all the surgical downtime, swelling, that kind of stuff. So I'll show you a couple examples. So great example here. This is a patient with just 1 treatment. 1. Now this patient does not have much extra skin, so extra fat, so 1 treatment is going to be sufficient for that person. I'll show you in the next example. This person, a little bit more extra fat in the chin area, and just after 1 treatment, not completely reversed. Like I said, it's going to take 2 to 3, but just after 1 treatment, look at that neck versus that neck. See how it's tightened? This line is a lot straighter. All of this fat in here has kind of gotten reduced versus over here. This line is kind of bowed out, all this bulging fat in there. So pretty good result for 1 time. And a great one here, this one was treated actually with liposuction. It was a little more aggressive than the Kybella, but we get it all done in 1 procedure. Again, look at that rounded shape. Now we got that beautiful, almost like we did a neck lift on this patient. Look at that tight angle right there. Round here, beautiful, tight angle, excellent jawline. All right, y'all, well, that about does it. Thanks for tuning in. I hope you got some educational stuff out of this, and we'll be back with you hopefully tomorrow. See you later.